Hi, this is Anu, and you're watching Anu for Nurses. Today, we are going to discuss one important gland of endocrine system, that's adrenal glands. The glands that sit on top of kidney, and you can say like it produces stress hormones or emergency hormones that helps in fight or flight response. As a result, your body becomes alert, a lot of sweating, increases the heart rate, cardiac output, and cellular respiration. Let's see what are the parts of this adrenal gland, which are the hormones produced by each cells in it, and what are the functions of it. We can divide the adrenal gland portions into adrenal cortex and adrenal medulla. Adrenal cortex produces the hormones called aldosterone, cortisol, and sex hormones, and adrenal medulla produces catecholamine. The cells that specifically secreting these hormones are glomerulosa, fasciculata, reticularis, and chromaffin cells. GFR, that is there in the adrenal cortex, is the glomerulosa producing aldosterone, and fasciculata producing glucocorticoids, reticularis producing sex hormones. You can remember the acronym GFR and AGS. GFR, the glomerular filtration rate, since it's sitting on top of kidney, connect to this and remember GFR. And chromaffin cells producing catecholamine. That is in short about the anatomy review of this, and let's see what are the functions of these hormones. Aldosterone, mainly it helps in the sodium and water reabsorption, potassium excretion by the kidneys, and it maintains BP. This single sentence, if you remember, it would be easy for you to recall the electrolyte imbalances happening in hypo and hyper functions of adrenal glands. So remember sodium and water reabsorption and potassium excretion by the kidney, and it maintains BP. Cortisol. Cortisol has got many other properties. It's also a stress hormone and it has got anti-inflammatory property. It causes immunosuppression, it stimulates gluconeogenesis, lipolysis, and also stimulates RBC production. It's a red blood cell production. What is the hypofunction of adrenal glands? Hypofunction is Addison's disease. Remember, it's a hypofunction of adrenal glands. So both the cortisol and aldosterone will come down. So hypofunction of both these hormones, what all effects it causes. And before that, let's see what are the causes. First one is autoimmune adrenalitis. Autoimmune disease of adrenal gland is one reason for this, and TB-like infection is another reason. Then cancer. It can be direct cancer at the adrenal or hypothalamus or pituitary tumor, or sometimes it can be metastasis from liver or stomach. These are the two parts from where metastasis happens to the adrenal glands. And then adrenal or trauma or hemorrhage into it. Also some storage disorders like hemochromatosis and amyloidosis. These also can be the reasons for Addison's disease. What are the features? Mainly we can think in decreased and increased things. So we can categorize it into these two. And temperature will come down, BP will come down. Remember, the function of aldosterone is sodium and water reabsorption, potassium excretion. So when this hormone comes down, opposite of this happens, right? Sodium and water will be lost and potassium will be retained. So what happens? BP comes down and hyponatremia will be there. Normally when there is fluid loss, weight loss will be there and causing low mood and energy, low glucose level. This is the contribution of cortisol. Then decreased hair, you can call alopecia, and menstrual disturbances, it's a decreased periods or amenorrhea. So these are the main thing, that's decreased things happening in this, and increased potassium will be retained, right? So hyperkalemia will be there, and increased skin pigmentations, that's called the brown skin. That's an important feature of Addison's disease. Brown skin, that's the increased skin pigmentation, and calcium level will go high. That is actually because of combination of increased calcium input into the extracellular space and reduced calcium removal by the kidney. These are the two reasons. It's a combination of increased calcium input into the extracellular space and also reduced calcium removal by the kidney. This both together will be leading to hypercalcemia. If you don't remember the reason, at least remember there will be potassium and calcium increase. And bowel movements will be increased, so that means diarrhea will be there. And one another important thing to remember is the acid base imbalance that's happening in this. That's a metabolic acidosis. How metabolic acidosis happening? The sodium resorption or sodium loss is linked with potassium H plus secretion. So when there is sodium loss, there will be H plus retention in your serum. And H plus ions, when it is increasing, that will be leading to acidosis. That's how metabolic acidosis occurs. So these are the important features to be remembered in Addison's disease. Remember, decreased temperature, BP, sodium, weight, mood and energy, glucose, hair, and amenorrhea. You can also see increased skin pigmentation or brown skin, and increased potassium and calcium, diarrhea, etc. Now, what is the test you are doing in this? ACTH stimulation test. That's an important test you are doing. You are giving ACTH or POMC. That's a propionmelanocortin. That's a precursor of ACTH and MSH. How will you manage this? For any management, first thing you should be thinking about the reason. So if it is some tumor associated, or what's the reason to be removed. And since it's a hypofunction, you can give hormones to replace. So this is the management. Now, you need to know, for most of the endocrine problems, there can be crisis occurring. So here in Addison's disease also, the important complication is called Addisonian crisis. So when this Addisonian crisis occurs, when there is already patient has Addison's disease and the patient having some stress, infection, or patient is in shock, or suddenly not taking the drug, rapid removal of the drug, or is undergoing some surgery, Waterhouse-Friderichsen syndrome. That's actually some bacterial infections causing bleeding into the adrenal glands and adrenal failure that lead to Addisonian crisis. Usually it goes to by the bacteria Neisseria meningitidis. So that's a Waterhouse-Friderichsen syndrome, and stress, infection, shock, or suddenly stopping the drug or surgery. These are the reasons for Addisonian crisis. So how the manifestations will be? What will be the complaints? Sudden pain in the abdomen or the lower back, severe vomiting and diarrhea, severe dehydration, syncope or loss of consciousness, and severe hypotension. Remember all these features that you are already seen in Addison's disease. These will be increased, definitely, right? There's crisis now. The same Addison's disease patient is in crisis. So all these features will be severe, and typically first they might experience a pain abdomen or lower back and diarrhea, dehydration. Because of severe dehydration, they might lose their consciousness, and severe hypotension will be there. These will be the features. And how will you manage? Priority care is very important. First priority, these questions typically ask, and you should be knowing what should be the first one, that you will have, whether you will be giving fluids because patient is dehydrated, or you will give IV corticosteroids or oral corticosteroids, or you will maintain air. What is the first priority that should come to your mind? It's always IV corticosteroids or hydrocortisone that is to be given to the patient immediately. That is the immediate management. Second one is IV fluid, and then as the maintenance you can give oral steroids. That's all about adrenal and its hyperfunction. That's we are winding up for today and continuing with the hyperfunction of the adrenal gland in the next video. Till then, stay tuned. Bye.